So I'm Harrie, I'm a researcher at Healthy Active Cities, and me and Matt are presenting on our opinion piece we wrote for the BMJ earlier this year, or just at the end of last year, on why free parking in hospitals isn't caring. Matt, did you want to introduce yourself as well?
Yeah, so I just wanted to introduce myself. My name's Matthew Jackson. I'm a consultant at one of the local hospitals in Manchester. And I guess different to many of the other speakers, I'm speaking more from an experiential basis as opposed to a research, having researched this issue.
Great. So the starting point for our research, really, or our opinion piece, is that there's been lots of things in the press kind of ongoing. So more recently in COVID times, we've had free parking for NHS workers in hospitals, and then free parking was taken away. But long before that, there's been lots of discussions about free parking and pledges by political parties as well to make sure that parking in hospitals is free. So the point that we want to start with is that parking is central to hospital care currently, and this is because as hospitals and health service are being rationalised into fewer, larger units that serve wider areas, that they're becoming much more difficult to access by alternative forms of travel, and this is in part because our planning systems are so car-centric. It's not to say it's necessarily a bad thing that these services are becoming centralised, and there's quite a lot of evidence that shows improved clinical outcomes, especially in trauma. I think strokes, cancer care showed improvements in this centralisation of care, but they are becoming much more difficult to access without a car. And when we're thinking about access, it's more than just getting there, it's being able to get there at reasonable cost, time, ease and safety, and recognising that there's intersectional differences in those experiences across gender, disability, ethnicity and age in particular. One example from Karen Lucas is that 66% of elderly people are unable to reach a hospital within 30 minutes by public transport. And an example for Greater Manchester, for example, is I live very close to the Central Hospital, but I use Salford Royal a lot. So it's 30 minutes driving in traffic, 30 minutes cycling, but 60 to 75 minutes if I needed to use public transport. So that's huge, that's more than double the amount of time. So that's kind of what we're talking about when we're saying that access is more than getting there. So the problems that I'm going to cover with free parking for NHS hospitals and NHS workers is that it's inequitable and it reinforces the unsustainable increase in private car use. And then Matt will cover another topic within that. So in terms of it being inequitable, I'm talking about forced car ownership. So this is when people have little alternative to buying a car in order to access opportunities such as employment. And it's often the result of the geography, the temporalities of public transport, the lack of active travel infrastructure, for example, as well as kind of the costs and dangers associated with using those. And then care work in hospitals, and particularly shift work, is at the intersection of these, although it should also be recognised that there's a huge proportion of staff within hospitals, for example, that aren't doing shift work and are working kind of 9 till 5, 8 till 4 hours. So I think Matt might mention those later. And that you need to recognise that the consequences of forced car ownership are particularly significant for lower income groups, and that if you think about the cost of a car maintenance and running as a fixed cost, it's going to be a higher proportion of lower income salaries than higher income salaries. So when we look at who actually works in the NHS, there is a large proportion of low income workers or lower income workers. Most of the research, I think, in general on NHS looks at doctors and nurses, which is why when we're looking at lower income workers, the research reflects a lot on nurses' pay. So a £6,000 real-time pay cut over the past decade really kind of shows who I'm talking about when we're talking about lower income workers, and that when we're talking about forced car ownership for low income groups, you actually see that when people are being forced to run a car because they need to do that in order to access their place of work, they're more likely to have experience deprivation in other areas of their life in terms of food poverty, fuel poverty, and also access to social activities. So people who are experiencing forced car ownership and deprivation as a result of this are less likely to participate in social activities that you need to pay for, such as kids going to after school clubs, sports clubs, those kinds of things. And then during the pandemic, there's been research into nurses skipping meals and accessing food banks in order to save money. So really thinking that we can think of free parking as a way to support people, but actually if we're reinforcing people having to own a car because that's the way that we're designing our travel systems, we're actually forcing people into poverty through doing that. And also to recognise that the lower income groups suffer most from the externalities of car-centric development. So low income groups are more likely to live in areas with busy roads and suffer the pollution, the community severance, and the road traffic accidents as a result of those. And then the other aspect of the free parking is that it's a subsidy for those who drive. So there's no similar support for those who are cycling, walking, using public transport. And that within this, the UK road transport contributes to 1/5 of our greenhouse gas emissions. Climate change is expected to have extensive detrimental health outcomes in terms of pollution, in terms of the impact on food production, in terms of the impact on pollen levels. So, and that air pollution is the biggest environmental health risk. And in the UK, there's associations between child respiratory hospital admissions and adult cardiovascular hospital admissions in terms of air pollution, and that hospitals then, because of these transport plans, that they are in areas where the pollution levels often exceed safe and legal levels. So they're the two aspects in terms of the inequitability and the unsustainability that I wanted to cover, and Matt will take over from there.
So there's a real problem within the NHS in terms of reward for work. The graph I've put there is from the Nuffield Trust, and it demonstrates different pay bands within the NHS, but all of them demonstrate a fall in pay when compared to both private sector wages and inflation. So over the last 10 years, there has been a functional pay cut for NHS staff. And there's no question from an anecdotal level that staff go out of their way to provide above and beyond what is required contractually. So in one sense, there is this real requirement for society to consider how we're reimbursing NHS staff. Parking is an easy win because for the most part it's relatively easy and relatively cheap to provide, and it's politically quite popular. But in many ways it's tokenistic compensation for those real pay cuts that NHS staff have had. And as Harrie's demonstrated already, it is a reward for certain members of staff, but does have economic downsides as well. The question of how we think about rewarding NHS staff is also slightly problematic. There is a sense that perhaps healthcare workers in their work are special and different from other sectors, and perhaps we saw a little bit of this during the early weeks and months of the pandemic when we had this outpouring of thanks for the NHS. But as that unravelled, we appreciated that actually the employment that we're all involved with is essential for functioning in society. We need to be slightly careful about whether we reduce reward purely down to a financial transaction, because ultimately healthcare is about caring for patients, and the reward that needs to be put forward needs to be a reward that is caring towards staff, and perhaps encouraging more car usage is not the most caring thing that we can do. The NHS, as with most employers, has a duty of care to both those that they employ and those that they provide a service to. healthcare is about health, and if we look at the health costs of commuting by car, it's got a financial cost of about 40 billion a year just in the negative health effects, and that comes from inactivity, air pollution, road traffic collision, and mental health sequelae. So the caring thing, it would seem to me, is if we think about rewarding our staff, not by an activity that's going to result in deterioration in their health, but actually thinking about how we can move in a different direction that is going to start combating some of the negative health problems associated by increased car use. Then thinking about the other set of people that the NHS has a responsibility for, the patients. You know, a lot of healthcare professionals sit in clinic and talk to patients who are unwell because of inactivity, because of air pollution, and you just wonder whether, as healthcare professionals, actually what we should be doing is modelling healthier ways of living, as opposed to continuing to go down this route of increased car usage. And that really is the crux of the situation. By offering easy to use car parking, we're preventing these more healthier activities, in addition to the points that Harrie raised earlier. So what's a way forward? How can we do things different? Well, I think the NHS needs to consider how it's looking after its staff, but how, as an organisation, it's also modelling healthy lifestyles to patients. One thought is developing hospitals and clinics more as active travel hubs, and that is not just the local infrastructure on site, but also thinking about how the routes that patients will take onto site, both by active travel and public transport, and engaging with local councils public transport providers to provide that. There are the things that can be done on site to make active travel easier, safe, bike storage, changing rooms, showers, tool stands. Then there's actually supporting staff to consider alternative means of transport, and that requires needing people to champion alternative ways of getting into work, having user groups, supporting people with trainers and mentors. There's already some financial incentive within the NHS, as there is in many places of work, with Cycle to Work scheme, to help offset the initial costs of buying a bike. But really what we're thinking about is, you know, sort of the carrots and the sticks to think about that modal shift. By providing free parking, the carrot is that coming to work by car is just easy, and that has the negative economic aspects that Harrie talked about, as well as the negative health benefits that I've highlighted. Harrie, have you got any closing comments you'd like to make?
No, that's good. Thank you.
Thank you for listening.